Well, October is Breast Cancer Awareness Month, so it's a good reminder to get in tune and in touch with your body. Remember the self-exams we were taught as kids, or maybe you don't? Well, Dr. Pyle Coley is here to remind you what steps to take for protection and prevention.
Well, Dr. Coley, October is Breast Cancer Awareness Month.
Yes.
So it's important to chat about this right now, and I think that it's important for a lot of people and a lot of women to know exactly what we're dealing with here. So how many women, first of all, are diagnosed each year?
You know, there's about 255,000 women that are diagnosed each year, and believe it or not, 2,300 men each year. So breast cancer is not just a disease of women, it can affect men as well.
Wow, yeah, I think we forget that piece a lot too.
Yes, and unfortunately, just like with everything else in medicine, the disparities in breast cancer, so black women with breast cancer do much worse than many of the other races. So it's another one of those conditions where there's huge disparities in healthcare.
Well, it's something that, you know, we can kind of start screening for ourselves, I think, too, which is nice. Is checking ourselves pretty easy?
It's very easy, Danny, and they recommend that you start doing self-exams around the age of 20.
Okay.
And then you start having an exam with your provider and a mammogram when you turn 40. So have you ever done a breast exam?
I have to admit I haven't, and that's another reason I want to talk to you. So
Yes.
Walk us through what we would do on ourselves first.
Okay, so basically you want to check it about 1 week after the first day of your period. So just about when your period is ending, because that's when the hormones are not quite as active. And you can do it in the shower, or you can do it in bed, and you want to put one arm up above your head so that it really flattens out the breast. And I like to use the clock method. So there's two different methods, clock or wedge. The clock method means you think of the breast like a clock, and you start at 12 o'clock and you work through every quadrant. You know, so 12 to 3, 3 to 6, 6 to 9, and 9 to 12. And you go in and out like spokes on a wheel, and you make sure you cover every part of the tissue. Then you also want to check the armpit for any lumps or bumps. You want to squeeze the nipple, make sure that there's no discharge. And then the wedge method is similar. You just divide the breast into wedges instead of a clock, but you want to make sure you're covering all the breast tissue, including the little piece of breast tissue that extends into our armpits, actually.
Okay, and is this something that, you know, upon doing just ourselves is pretty effective and maybe catching something early?
Well, you'll be surprised. Usually something has to be about the size of a marble or 1 centimeter before we feel it, but a lot of cancers are picked up by women on their self-exam because you're only seeing your doctor once a year. You're only getting that mammogram once a year. So in between all that time, if there's a little cancer growing, your hands will be able to pick it up. And women know their breasts. They know how they feel, so they're much able to better distinguish what's kind of normal or cystic changes versus what might be a mass.
Yeah, very, very important just to do, like you said, at home. What about prevention? Is that something that we can work on or do?
Yes, and so there are lots of things, lifestyle things that we can do. So don't smoke, you know, maintain a healthy weight and exercise. But hormones and birth control are something that we don't often think about in our 20s that can affect our risk for breast cancer. Whether we decide to breastfeed or not when we have babies, that can affect our risk of breast cancer. And then of course family history, if you have one of those BRCA mutations like Angelina Jolie, for example, that can certainly affect our risk. So if you're somebody who has a family history, I would say talk to your doctor before you think about birth control pills, hormone replacement therapy, you know, even decisions about whether or not you might want to have something like a mastectomy before, you know, if you're a gene carrier.
Sure. I mean, it sounds like it might be a difficult conversation to have with a doctor, but a very important one, right?
So important, so important.
Definitely. So what are the recommendations when it comes to mammograms and visiting a doctor? We talked about, of course, self-exams. What about, you know, going in?
So once a year after the age of 40. Now you start sooner if you have one of those BRCA mutations or you have a family history of breast cancer, especially in a first-degree relative, like a sister who had it young or a mom who had it young. So anyone who has, you know, family history, that tells us that we need to get our guard up on them. But for the average person, 40 years old, you start to have your first mammogram, and then annual mammograms once a year after that. And people like to do it on their birthday or just after, because that's a good way to remember to get it.
Yeah, definitely. That's actually not too bad. So pencil it in, everybody. Dr. Coley, thank you so much for talking about this. This is something that, like we said, might be difficult to talk about, but I think is a very important conversation to have.
So important, and we all need to talk to our friends about it too.
Definitely.
So pleasure to be here.
Thank you.
Well, thanks for the tips, Dr. Coley. And here's another great way to practice prevention. Sign up for a 9Health fair. They run now through November the 13th. Check your nearest location and pre-register for your health screening by visiting 9healthfair365.org.